controversial anti-malarial drug has been flagged as a possible treatment for COVID-19. But Australian Defence veterans given the drug as part of a clinical trial 2 decades ago say they're concerned about its safety.
20 years on, and the drug tefenoquine still haunts former soldier Glenn Norton.
All of us that were on those drugs were having nightmares and things like that. We had people literally screaming in their sleep.
He's one of almost 700 soldiers given tefenoquine during peacekeeping missions in Bougainville and East Timor as part of clinical trials by the Australian military to test the drug's effectiveness in preventing malaria. Mr Norton now suffers depression, anxiety, paranoia and memory loss, side effects he blames on the drug.
I've been diagnosed with post-traumatic stress disorder, which I don't believe is what I have.
Tefenoquine is now being researched as a treatment for COVID-19, but some American doctors warn the risks may not be fully understood.
There are lingering concerns about the drug's neurotoxicity.
Dr Remington Nevin is an expert in anti-malaria drugs and says more research is needed.
Our group's concern is that there's simply incomplete study data on these drugs.
The Defence Department says the trials were conducted ethically and those involved are offered support.
There's been no check-up 5 years down the track. There's been no check-up 10 years down the track.
A 2018 Senate inquiry found there was no compelling evidence that tefenoquine caused long-term health problems and that the drug had undergone rigorous evaluation in Australia and the United States. The company that markets the drug is now planning to conduct clinical trials for COVID-19 treatment and look at any long-term impacts.
We are optimistic about this initiative, but our most important goal is to conduct as robust a clinical study as possible so the outcomes are clear.
But veterans like Glenn Norton say it's not worth the risk.
I would prefer to catch COVID-19.
Marion Farr, ABC News.